Hi, my name is Nathan MacChesney, and my topic for the rhetorical presentation, as well as Essay 3, is the obesity epidemic, which is something that has greatly influenced our society. I picked these two pictures here because they're good representations of what society is doing to us and what humans are turning into. Doesn't paint a pretty picture. So what is causing all this? The primary components that are contributing to and creating the issue are a overall lack of proper health and nutrition education, mostly in schools, the proliferation and ease of access of unhealthy foods, the role of certain cities and environments, and time poverty, which is simply not having enough time to prepare healthy foods and exercise in your daily routine. So diving deeper into education, lack of, this can be seen as perhaps the root of the problem. Without informed citizens who know the dangers of what they're eating and the conditions that can develop through these actions, nothing's really going to change. In an article posted on The Hill, Adrian Udeem tells us how shockingly low only 50% of all school districts and only 50% of all schools have district or state requirements for students to receive nutritional education, and only 27% of high school students surveyed had participated in at least 60 minutes per day of physical activity. Much of this also occurs while children are younger. By the time they are adults, much of the knowledge is lost. In an article on PubMed Central, researchers show the findings how parents lacking nutritional knowledge, especially in lower income backgrounds, contributes greatly to creating obesity, which now affects 17% of American children. It's huge. The doctors cite how literary issues may affect the identification of healthy foods. To only compound this problem, Alyssa Drigan reports how there is an overall lack of nutritional and obesity education among medical students. And these are the very people that are supposed to help everyone else and teach them and fight their own obesity. This creates a snowball effect. If a patient's doctor doesn't know how to properly teach or treat their obesity, then how will they? The easy access to cheap and unhealthy food. This is something that is shockingly obvious in a simple drive around town or a walk down a grocery aisle. The disproportionate amount of unhealthy fast food compared to nutritious alternatives. Consumers are bombarded by advertisements and product placements of fattening foods. To compound this issue, lower-income communities see a significant increase in unhealthy food options. In Los Angeles, for example, poor neighborhoods had a higher proportion of fast food outlets than wealthier neighborhoods, 25.6 to 11%. Or in New York City, percentage of African Americans in block groups, which is the people they studied, was positively associated with fast food outlet density. When fast food and convenience stores filled with packaged unhealthy foods is all that someone sees on a daily basis, they have no choice but to eat it, and when they've grown up around that food their whole life, they might not know anything different. Location, location, location plays such a big role. Not only the country or state you live in, but even the community level can have an impact on your health and eating habits. As Yvette Brazier said, people living in socioeconomically deprived areas were less likely to see their areas conducive to healthy behaviors compared with residents of wealthier areas. So this means even if there may not be a specific factor making you eat poorly or having limited physical exercise, many of the residents in these lower income areas point some of the blame to where they live. Certain societies are inherently more conducive to an active lifestyle. Big factors of this are weather, geography, transportation options, and proximity to gyms and parks. They all play key roles here. For example, California has generally pleasant weather and abundant outdoor activities, whereas somewhere like Mississippi can often be too hot or humid, or rains a lot, making people want to stay inside. These are all factors that contribute greatly to people's energy levels, their physical activity, and that's why places inherently have more obese people than others. And so here I picked out some graphs of the United States um, showing education levels, median household income, and obesity levels, and I'm tying in a correlation between all three of them. I don't think it's just a coincidence. So when looking at the percent of population with a 4-year degree. The biggest outlier here is Colorado in the Northeast, and then for high education levels, and then for low education levels, it's generally the Southeast going up into West Virginia, and you can see this trend continue with household income. Generally, West Coast is higher, and Northeast, when you see Colorado and the Northeast continue the trend, education and high income, and then the exact same places that had a low percent of the population with a degree, as in Mississippi, Alabama, West Virginia, Arkansas, they reflect the same trend. And now when we compare that to the obesity levels, there's a pretty direct correlation here. So obviously Colorado, Massachusetts, the Northeast in general have the lowest obesity rates in the entire country. And then when you get into the deep south here, Louisiana, Arkansas, Mississippi, Alabama, and then West Virginia is always the outlier. They have the highest amount of obesity, and when I zoom back out here, you can generally see the southeast here is, if you want to say the worst in every category, that's not a stretch. And then Colorado and the Northeast are generally the best. Colorado, I can see that as being an outlier because there's so many opportunities for physical exercise, and you have the mountains, you have skiing, generally good weather. You can see that with California. So through this, you can see how location can have such a big impact on obesity rates as well as education and income. There's a trend with less education, higher obesity levels. And so this ties in with time poverty. This concept talks about how poor people simply do not have enough hours in the day to do the little things that can be taken care of by someone that you can pay, because they're always working long hours to make ends meet. As Gabrielle Emanuel puts it, when you have a lot of money, you can use it to save time. Dishwashers, washing machines, cleaners, cooks, and babysitters are all part of the vast commercial and social service sectors that help the rich save time. And poor people they don't have these opportunities, or they cost too much, and so they have to manually do these things, taking up more and more of their day. And this requires them to fall back on eating cheap, fast, and poor nutritious food just to save time, and that's only contributing to the obesity in those communities. And here I've got a graph picture of the human body and just all the medical complications that can arise from obesity, anywhere to multiple types of cancer, the heart's affected, gallbladder disease, it affects your skin, your brain, you can have strokes. It just compounds one thing after another, and many of these can lead to serious complications, if not death. So clearly obesity is not something to mess around with. And these are my citations of all the articles that I referenced in my speaking. So I'll leave this here for a second so it can be seen. And that sums up my presentation of obesity and why it's such a serious issue in our society. Thanks for watching.